Good afternoon, everyone. You got it? Okay, there we go. Good afternoon. I'll call this meeting of the House Health and Community Committee? Community Health Committee, whatever they call us. We could go by various names. So, the whatever committee. All right. The House Health and Community, whatever. Okay. And it's called to order. Thanks to everybody for being prompt so that we have a quorum. And I'm going to let Representative Katie Dempsey go first. And you are up, and we are working off LC 339282.
Is that okay? Thank you. Thank you, Chairman Cooper. Appreciate it so much. Yes, this is House Bill 213. I believe you said LC 339282. So this truly is a very straightforward measure. It's evidence-based, a simple, truly 35-line bill. We don't see many of those, actually. So you can read it quickly. I wish everybody was reading it that seems to be concerned about it so that they could understand it. In 2009, the Georgia General Assembly passed legislation that allowed, but did not require schools to provide information on immunizations, infectious diseases, and medications to the parents or guardians of students. The law further stated that only if information on influenza or meningitis was provided, it should be provided to the parents or guardians of students in grades 6 through 12. The law did not and does not mandate vaccines of any type for these or any other illnesses or diseases. Since the passage of this law, the recommendations of the age for providing information only on influenza has changed, such that now it is recommended that parents or guardians of students in grades K through 12 receive that information rather than 6th grade through 12. The recommendation for meningitis information has not changed, and so it will remain grades 6 through 12. The bill simply recognizes the change in these recommendations and changes the influenza section to grades K through 12. That is all that this bill does. It does not require information to be provided by the schools, nor does it mandate that parents or guardians take any actions. It does not mandate vaccines or medications. It simply allows information to be provided to parents or guardians who can then use their own best judgment as to what is best for their own child.
Questions from the committee? Representative Chokas.
At the appropriate time.
Oh, okay, thank you, remind me. Amber? Other questions from the committee? Is the wording you have in this one, it seems like we do this frequently. Katie, in the past when using the same wording, am I
Very
correct?
similar. So if you look at the bill itself, actually, at the beginning of it, you will see on line 13, it previously began at 13, and then at line 15 and 16, it had meningococcal meningitis disease and influenza together. So it simply removes that, leaves the meningitis vaccine on its own, and repeats the exact same language for the flu vaccine, only changing that instead of grade 6, it is kindergarten. So it's what exists now, except for the need to lower the age for the information to be factual.
Okay. This bill brings back sort of very sad memories. My first year here, one of my constituents came to me wanting a bill to notify college students about the different kinds of meningitis, and especially the most severe one. Her son played baseball, for down at Carrollton. West Georgia. Called his mom one evening, said, "Mom, I'm not feeling very good. I'm not going to come home. I think I've got a really bad cold." The next thing she knew, the next day, he was in the hospital. And before 2 days were out, they had amputated legs. Then they amputated his arms. And he died and basically came home in a body bag. That's how bad the severe, one of the types of meningitis is. Been a long time since that, and I'm sitting here getting cold chill bumps. So, but at least to notify the parents and make people aware of the seriousness of it. And we did it in college, to just that people be aware that maybe, because it seems to affect kids, that get together in groups, and if they're smoking or perhaps drinking, we don't know that our kids in high school would ever do that or anything. But so it's one way that we've had of trying to inform parents about the seriousness of this disease. So with that, I'll turn it over to Representative Hilton.
Thank you, Chairman Dempsey, for bringing this good bill to us. I appreciate this. I believe the bill originally, with Title 20, came through the Education Committee, and I received a number of folks that reached out to ask that it be amended to include language on exemptions or being able to opt out for religious or other reasons. Was that taken under consideration? I'd be curious to get your thoughts.
Well, I have, and that's already law, actually, in section 20-2-771E. It provides that a parent may object on religious grounds to laws or rules mandating vaccines for school children. This law is already in effect, so that's already there.
Perfect. Great. Thank you.
Representative Washburn.
Thank you, Madam Chair, and thank you, Chairman Dempsey, for bringing the bill. This may be just an obvious question, but I am getting a lot of messages. This is simply to provide information about these illnesses and about the availability of the vaccine, and expanding the ages of children to whom the parents are notified of it. Is that correct?
That is correct, because the guidelines changed from that age down to the kindergarten age child. So that's why it changes. The language in the bill, if you look at the bill, it is exactly the same as it was. The language too is very specific for good purpose. It doesn't allow for mandating, actually. It allows for the facts about the two different diseases and what that notice, if they do decide, should include. And it's a description of causes, symptoms, and means of transition, a list of sources for additional information, related recommendations issued by the Advisory Committee on Immunization Practices of the federal CDC and prevention. That's all it is. This is within the bounds of the law to make sure that it's handled appropriately, that there's no sort of wiggling around of the facts, no pressure to provide or take the shot.
Thank you.
Thank you, Madam Chair. And Chairwoman Dempsey, thank you for this bill. I think this is a good bill. What I like about it most is it still gives that local control to the local board of educations on what they want to decide they want to educate their students on, because it starts with the big word if. So that was very important to me. But I do want to ask, and you may not have exact numbers, but if you could just tell us what you may know generally, are we seeing an increase in influenza amongst kids starting as early as kindergarten? The reason we're now changing this language to include that educational piece for them?
No, I can't tell you if it has increased. I think we've gone through a strange time with the pandemic and the masks that we all wore, and Dr. Al may know more about this actually than I do. But there was not as much a prevalence because we were all protected from a lot of things actually. But I do know that the CDC has said that this is an age-appropriate vaccine. Was just starting at 6th grade, now it is now at age 5 for kindergarten, is the way I understand it.
Well, I can already tell you that there has been an increase. Some of it is because people have gone with the mask, and we had a couple of years that had a lower incidence of influenza, the mask can come off, and of course, they've seen an increase. And Dr. Al, do you have anything else you want to add to that?
No, I
Not
was just
to
going to
repeat
point
it?
out, isn't it true that all this bill does is align our information dissemination practices in schools about these diseases with current clinical guidelines?
Yes.
Absolutely, thank you. And I do want to apologize to all of you for the calls you may be getting. I know your offices may be a little worn out. Mine was today when I stepped off of the floor. You know, I understand and respect the concern. None of us would want to mandate anything on anyone, such as a vaccine. That would be a dreadful thing, I think, for any of us to do. But also, I think it is great for any of those constituents that you know for you to encourage them to read this very short bill and make sure they fully understand what they are calling about.
Okay, and I'll add to that, if you're getting calls about Senate Bill 1, could you please just, in your responses, tell the people, if you're emailing them back, that it is the practice, and has been for years, for the House not to take up Senate bills until after crossover or right at crossover time. Every once in a while, there'll be one that has high priority from leadership that gets moved more quickly, but normally we don't do that because our phones are being rung off the hook about that. So anything you can explain to people how the legislature works, I would appreciate a little help on that, if you would, please. Representative Anilowitz.
I believe it was probably during the 2018 session, and there was a hearing here in this room, and a young woman who was a survivor of this meningitis came and testified before. I was not on this committee yet, but she came and testified before this committee, and her story was so compelling, and I'm glad that this virus it's being addressed in this bill. Again, this isn't changing anything about exemptions. It's not putting any mandates in place, but I think being able to have information communicated to parents and to families that this vaccine exists, because especially in communal settings, in a college dormitory, is that kind of communal setting.
High school.
Yes, high school. Yes, they flock together, and it's wonderful. But it's not if there's meningitis going around. So thank you for bringing us this bill.
Thank you.
I don't see any further questions. What would the committee, and I recognize Representative Chokas for a motion.
I move that House Bill 223 LC 339282 receive the due pass designation.
Okay, I have a motion and a second. Now we will have time for discussion. Is there any more discussion from members of the committee?
Just to clarify, it was 213.
213.
213.
Just
Yeah.
one. that one.
Thank you.
You beat me to it.
Didn't have my glasses.
Okay, and is there anybody in the audience that would like to speak to the bill? Okay, seeing no one, then it is time for a vote. Everyone in favor of the passage of House Bill 213, say aye. Aye. Anyone opposed? Okay, that's without opposition. The ayes have it.
Thank you.
Thank you very much. Okay, I'm going to sit here because I have House Bill 226. It's about HIV. Those of you that have been here, this bill passed out of this committee last year. Same bill. Got over to the Senate, and there was money in the budget, and we got a message that the money was in the budget, and we no longer needed a bill. When it got to the governor took that line item out of the budget and said we needed a bill for it to be in the budget. So here we are. So it's the very same bill. What it does is we are seems like almost the center of the universe for HIV, syphilis, all of the sexually transmitted diseases, and our numbers are going up. When somebody has HIV, if they can't get their medicine, if they don't get health care to a certain degree, because even without having an active case of AIDS, they're often debilitated. And so this moves currently, once you get a full-blown case of AIDS, because that's what HIV does. HIV, if it's not, kept under very careful control, which we have the medicines to do now, so that most people, there are occasions when the medicines don't work, but for most people, there are medicines now, when taken properly, allows them to live a regular life with what's it called, the level, with their, what? Well, it's undetectable, and I've just lost the immune. Kathleen, are you in here? Their viral suppression load. It keeps the viral level suppressed, and they can live a normal life where they do not transmit the disease. However, if they do not get their medicines they need, or if they have other illnesses that can debilitate them and, things get worse, they get full-blown AIDS. We cover in Medicare, Medicaid, people eligible for Medicaid, as soon as they become and have a full-blown case of AIDS, they automatically, if they're eligible for Medicaid, go on our Medicaid system. Our HIV people don't. And this would meet the people who qualify for Medicaid that are HIV positive. We would put them on our Medicaid program now so they could get proper care, get their medicines, and not transition into full-blown AIDS if at all possible. Cost about almost $10,000 on Medicaid to treat these people. If they go to a full-blown case of AIDS, it's about $30,000 a year. So it's a definite savings to the state, to us to take care of these people that are eligible for Medicaid. It will reduce our cost in the long run, should they develop, full-blown AIDS. And that number of 30,000 does not include if they have a hospitalization, any other kind of bad complications. And if you have full-blown AIDS, that can run into the hundreds of thousands of dollars. It's only the maintenance part that makes the difference, where we save over $20,000 a year if we put them on our Medicaid program. So I will, ask me the questions. Do I have any questions? Okay, I will entertain a motion. You've had your, Jokers, you've had one. Okay, Dr. Al, and then Scott, if you'll do a second.
At the appropriate time, I'd like to move due pass on House Bill 226.
This was
Second.
appropriate time. Seconded. Thank you, Scott. Okay, discussion. Any more discussion? Somebody have a question? Yes.
Madam Chair, quick question. I'm sure I trust your infinite wisdom on this, but the 138% poverty level, was there any particular reason why they chose that level and not higher or not lower? I'm just curious why that particular level.
Nobody has asked me that question, but I would believe that, Kathleen, would you like to step up and
Well, according to the federal schedule, 138% of the poverty level is $20,120. So a single person with that income or less, I think this is saying would qualify, correct?
Dr. Al?
I saw that number too, and I suspect it's pegged to what we often do when we approach Medicaid extension, that we pick that level as a reasonable level for enhancing coverage to people who have no insurance.
So it's more of like an industry standard for these type bills, if you will.
Well, it's common to many Medicaid
Gotcha.
extension
Not bad.
That's a
legislation.
satisfaction. I had no idea at all.
Okay. Kathleen, do you have anything to add, since you're our resident expert on? No. Dr. Al was correct that it's the standard. Okay. Thank you. Thank you for that question. Nobody had pinned it to me on why we chose that number. Thank you, Dr. Al. Other questions? All right. Do we have anybody from the audience that would like to speak to this bill? Yay or yay or for, whatever. Okay. Seeing none, it's time for a vote. Everyone in favor of House Bill 226, say aye. Everyone opposed, say no. Okay, the ayes have it, and I thank you very much. And we have appropriations coming here after us, and so thank you for being here on time again and us moving these bills. Thank you very much. We are